Hello, so today we are talking to Orla Rooney, who is a community dental officer with the Trust. Hello, Orla.
Hello, Paula.
So, Orla, most people will go to a general dental practitioner outside of the Trust. Can you explain why some might have to come and use our community service?
So most patients can go to their own dentist. Dentists are absolutely brilliant at treating them, but they just sometimes might feel that they would like a bit of our support for some patients. So these could be young children who maybe are just too young to be able to manage dental treatment on the chair. And so they might need a little bit of, sometimes it's just a little bit of time and acclimatization. And sometimes it might be a little bit more than that, if they have sore teeth or maybe teeth that need to come out, they might need to go to sleep just to help them get that completed. Or else maybe other special care patients who might need to be seen that little bit more often. Our clinics can sometimes be a little bit quieter, a little bit calmer, and for some patients, that might be something that's very helpful to them. We also will go see patients who maybe can't make it into the clinic at all. So we do quite a lot of domiciliary visits. So we're screening in nursing homes or learning support units in schools and things like that. So it's a lot of different variety every day.
And where are you based, Orla?
So I work in Portadown and Dungannon, but we also have clinics in Newry and Banbridge and Armagh and Brownlow as well. So we're all over the Trust.
Okay. And I understand you're fairly new to the Trust.
Yeah, so I only started in January 2020. So it was a brand new job, and I used to work in practice. And once I joined the Trust, very quickly, obviously, everything changed. But the team were brilliant. They were really, really welcoming and very supportive. And even though everything changed and everything was different, and I was very new, I always felt very supported and a very valued member of the team, just throughout the whole thing.
And can you tell us then a wee bit more about how your team adapted to working with COVID?
Yeah, so I was in March 2020, nearly overnight, we had to stop because dental treatment, nearly all of our treatments are aerosol generating procedures. Like anytime we pick up any instrument, nearly it creates an aerosol. And at the time, everything had to stop. Everybody wasn't fit tested. There was a real lack of PPE. We really didn't know what we were dealing with at the start. But patients still needed to be seen. Toothache is terrible. And just because COVID happened didn't mean that toothache stopped. So we had to work together with the general dental practitioners and everybody to figure out a new way of everybody getting the treatment that they require. And so we had to set up the urgent dental care centre with the GDPs, and everybody was involved in that. We had the infection control nurses, and estates had to come in. We had to develop a new flow for everything, make sure that everything was safe and that we could still see those emergency patients.
You talk very much about people working together. Orla, is there anything that stands out for you over the last year?
As I say, I was very, very new to the Trust, and really from the very first day, I felt really part of the team. And even though we maybe couldn't see all of our patients and the more routine things couldn't be seen, we were still very busy, and we were, out working with all the other people that we would normally work with, but maybe in a different capacity. So normally we might be out in nursing homes screening dentally, but this time we were taking part in the swabbing, the COVID swabbing of all the residents. And the theatre teams as well, like everything else, there's massive reduction, but people still needed to be seen, people still needed to get their treatment. So we worked together with the theatres to make sure that all of those emergency patients were still being seen and could be managed within the Trust.
And Orla, do you mind telling me a wee bit about yourself? Obviously you work hard keeping people out of pain and promoting oral health. What do you do for yourself to take time out?
Normally go on holidays, but that's not something we can do. So I think with spending a lot more time in the house, really the kitchen. So I've spent an awful lot more time cooking. And I think realizing that maybe a lot of stuff that I maybe bought before was easy to make myself, you know, and I really developed a new love of just trying out new things, not always successfully, but it's normally edible, and practice makes perfect.
And as a dentist, so would you be very conscious of staying off the sugar?
I wouldn't have a massive sweet tooth anyway, just personally. I would always, if there was a choice between sweets or crisps, find me at the crisp bowl. But I obviously, you know, everybody has a treat, and would still have my, you know, birthday cakes or cup of tea with a biscuit. But like anything, it's everything in moderation. And with sugar, it's all about trying to keep it to your meal time. So, you know, if you're having it with your dinner anyway, then, you know, you can go ahead and have your wee treat. We all need something.
I must remember that wee tip. So Orla, have you any plans or anything you're looking forward to if life returns to normal in any way?
I'm hoping it's not too far in the distant future, but I'd be really looking forward to just seeing everybody again. You know, I've missed seeing all of my family and my friends, and I just got engaged last week, so hopefully that will be something to look forward to, and we can start planning it.
Congratulations, Orla, that's lovely news. Enjoy the planning, and thank you very much for taking time to speak to us this morning.
That's lovely. Thank you so much.
Thanks. Bye.
Bye-bye.